Yeah. As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Good morning, everyone, and happy Friday to all. My name is Giselle Carlota McDonald, and I'm the Executive Director of Project Access New Haven. Today, I'm very honored to be your guest host. A big thank you and shout out to Tom Ficklin for gifting me the space to have a conversation on community health workers in Connecticut. For those not familiar with Project Access, I would like to start by just briefly sharing that we are a local nonprofit organization that works to increase access to medical care and services for uninsured patients in our community. All the services are donated to our patients, including the medical care, and at the core of the services are patient navigators and community health workers. In today's show, we will talk about everything related to community health workers, from defining who they are, the certification process in Connecticut, the skills and the roles that they play in the healthcare system, the work of the community health workers during the COVID pandemic, and also offering trainings and job opportunities at the end for those interested in pursuing a career in community health workers. So let's get started. I am very lucky to have three amazing guests with me today. They're joining me in this conversation. All three wear many hats, but one thing that they all have in common is that they have dedicated their life, their careers into helping others and advocating for the needs in the community. So let's get started with some quick introductions first. So let's see, Millie Seginat, if you don't mind, would you mind introducing yourself and sharing some of those many hats that you have, that you wear for CHW work?
Thank you so much, Giselle. So my name is Millie Seginot. I am a certified community health worker, independent contractor, working with different organizations in Connecticut, president of the Community Health Workers Association of Connecticut, former ambassador for the National Association of Community Health Workers, adjunct professor at Gateway Community College with the Community Health Worker Training course, an instructor for another nonprofit organization in Connecticut as an instructor for the training course for community health workers. And I want to mention that I am the first community health worker certified in Connecticut and also the first approved trainer to provide this type of trainings in Connecticut, and this certification was approval is coming from the community health worker advisory body that is under the leadership of the Office of Health Strategies and the Connecticut Department of Public Health. So a lot of things, but that's me working with the community and also with the workforce. Thank you.
Thank you so much, Millie. Thank you for joining, and many, many hats as I share, including being a mentor, right? I want to acknowledge that you have been a mentor for all of us in this show today. So thank you for everything you're doing and continue to do for Connecticut and the community. So next, I want to invite Liza Esteves to introduce yourself.
Hi, good morning. My name is Liza Esteves. I am a certified community health worker. I'm also a board member on the Community Health Worker Association of Connecticut. And I'm also a manager of patient navigation for Yale New Haven Health System, which means that I am a hiring manager for community health workers and patient navigators.
Welcome, Liza. And a great partner of Project Access and everything we do in the community. So thank you for joining today too. I know you're very busy, so we appreciate your time. And then not the last one, Millie. Actually, I'm going to start with some questions with you in a minute. So Millie Landock.
Thank you. Millie Landock. I am also a certified CHW. I am also a member of the CHW Advisory Board, and I'm here at Project Access as a program supervisor. I lead a team of community health workers. Thank you.
Thank you, Millie Landock. So let's get started with this great conversation. And I think one of the challenges that we might have today is staying within that hour of the show, because there's just so much to share about the work that we do and the work that has been happening pre-pandemic and right now during the pandemic. So Millie Seginot, if you don't mind, would you start us with some definition of the community health workers in Connecticut?
Absolutely. And I want to mention that the definition that we are referring to at this moment is what we have approved by legislature in effective in Connecticut in 2020. And I'm going to read the definition. It says, in Connecticut, by law, community health workers are public health outreach professionals with an in-depth understanding of a community's experience, language, culture, and socioeconomic needs. Among other things, they serve as liaison between community members and healthcare and social service providers, and provide a range of services, including outreach, advocacy, and care coordination. And as I mentioned, this definition is effective on January 1st of 2020 by Public Act 19-117.
Thank you, Millie.
Sure.
And Liza, you know, I'm going to jump to, as we hear the definition and all the work and the roles and, the outreach, can you share with those that are listening in, when we look to hire, I know you mentioned you're a manager. Can you share a little bit about those roles, the skills that a CHW that you see, that you train for, that you hire for?
Yeah, so a CHW they wear many hats in the community, as well as many hats in the healthcare system. And so some of the skills that we look for are skills related to communication, interpersonal skills, skills that help build rapport with clients and patients and community members, capacity building so that, we empower our patients and our clients to move forward and access those services on their own. And at some point, manage, learn to navigate the healthcare system. Also, outreach skills and also advocacy skills. So that is a key skill that we have, because we advocate strongly for our patients, not only in the community, but with community-based organizations, as well as with, providers in the healthcare system. Some of the roles that they can take on are roles related to case management and care coordination, as well as being cultural mediators. Some of them, community health workers come from the community that they serve, and they often have shared life experiences and culture and language with their clients and patients. So they take on, this role of cultural mediator, not only with, providers in the healthcare system, but also with organizations in the community. And one other thing that I want to highlight is that they also do provide culturally appropriate health education, lay health education, to help community members also understand what the doctor is asking them to do, and helping also bridge that patient back to the healthcare system by providing some insight into the patient's thoughts.
Thank you, Liza. Talk about hats, right? We all wear hats, but the role of the CHW wears so many hats and so many skill sets. And so let's talk about, because as you're describing it, Liza, I'm thinking of all the work that has been happening during the pandemic, right? Like a lot of work was happening pre-pandemic, but let's highlight some of what the CHWs have been working on this last 2 years, right? Like we're still dealing with the pandemic today. Millie Landock, I'm going to invite you to share some of the work and some of the things that you and your team have been working on.
Yeah, thank you. Well, we been doing is with guiding patients to resources that can help them address social needs, right? Any social need. A lot of patients shared, like you mentioned, during the pandemic, a lot of people were losing their jobs or having to stay home because their children were sent home. And a lot of people that were able to stay at home and work from home, they were the lucky and blessed ones. But there were many, many, many that did not get that choice. And so we had to, help them applying for, their services that they need, guiding them to. Some people that were laid off didn't know how to go about the application. They didn't know how to. I know that I had a conversation with a patient that never applied for food assistance before. Didn't know where to go to or who to reach out to. And so things like that. A lot of, while we were in the pandemic, in the middle of the pandemic, a lot of domestic violence, sharing from clients. And so we guided them through the services that could help them with address that need. Also housing. Housing was a big concern and still continues to be. And so, yeah, things like that.
Really hard work, right? Like as we share the work that we're all doing, it's really hard work. And Lisa, I'm going to invite you to, let's talk a little bit more about the definition in terms of the different titles, right? Today we're talking about community health workers, but what are all those different roles and titles that a community health worker may fall under? They might be known by other titles. Would you mind sharing some of those?
Sure. So the community health workers is the umbrella term for many different titles that are used all around the country and different countries. It's not just in the United States. An example of this is care coordinator. We can talk about a navigator, community coordinator. We talk about patient navigator. We talk about peer advocate, community health advisor. The important thing is that we recognize that all these different titles are falling under this umbrella for community health workers. We share the same scope of practice, roles and skills, and more than that, the code of ethics. So it doesn't mean that we all use all the skills and we do all the roles at the same time. It will differ by programs, what we represent, what we are trying to bring to the community might be different, but at the end of the day, we all have the same goal. And our goal is to help individuals from the community live a better quality of life. That's in general, that is our goal, no matter what we do. We are public health professionals and we all share, it's the same goal. This is what we are doing.
Love it, Millie. That's why you are the mentor for all of us, Millie. Thank you for that. So let's dig a little more on, let's see if someone is listening in today and they want to know, this is the career, this is the path that they want to take because they're helpers, they're passionate about helping their neighbors, their community members. What are the paths right now in Connecticut for certification? Can you, all of us, but I'll invite Millie Segino to get us started. What are the paths on someone that is interested in this career to follow?
Sure. So I don't know if Liza or Millie wants to take on that, but I can just share your experience by being involved with this process in Connecticut. So Connecticut had certification approved in 2020. It was a process that we had to start at some point with the the involvement of different sectors and different entities that supported us by guiding us. So we are able to be certified in Connecticut, and we have two pathways. It is a pathway one for those that are new into the workforce and they go through training. They need to go through, they need to be trained by an approved training vendor. We have 3 approved training vendors in Connecticut. One is Gateway Community College, the Health Education Center, and Southwestern Area Health Education Center. After you complete your training, and that is a 90-hour trainings, and 50 hours, at least 50 hours for an internship, plus other requirements, you have 1,000 hours of experience in the field doing the work as a community health worker, you are able to be certified. Our certified entity in Connecticut is the Connecticut Department of Public Health. All the process is online. This is a voluntary process. If you are a community health worker or under the umbrella and you decide that you do not want to be certified, you don't need to be certified. But I'm going to mention what will be the benefits of being certified in a moment. The other pathway that we have is for those that have many years of experience. They don't need to go through training if they don't want to. And they have 2,000 hours of experience or more. They can go through pathway 2. Another requirement that is the same for both pathway 1 and 2 is that they need to have a letter of recommendation from a professional that knows them and knows about the work that they have been doing. It can be the employer. And also a letter of recommendation from someone from the community, that's a community member, attesting about the knowledge of knowing this community health worker so they can be certified. Certification is renewable every 3 years. And the fee for the certification and the renewal is $100 every 3 years. We also have the opportunity to, if you miss your renewal date, you can always go back, apply again, and you will be recertified. So you don't have any problem. But everything will be done online. This is a very easy process to follow. And the benefit of being certified, even though this is voluntary, is that will give you the opportunity to work with employers that are requiring that the community health worker is certified. You might be hired and they will help you and they will support you in the process of certification. But we are working now into funding, and funding is looking to certification. So that is what is going to support us in this process. And another thing is that the recognition for community health workers in Connecticut, we are public health professionals. We are part of a team of professionals, and we want to be at the same level. And we want to be recognized for the work that we do that nobody else is going to be able to do within our communities, because we are part of these communities that we are trying to empower and make them be self-sufficient, all these individuals that they need help. This is our job. This is what we are here for. And this is what certification is all about in Connecticut.
Thank you, Millie. Wow, it's so great to hear, and I appreciate all the updates that you're providing to those that are listening. It's so great to hear where we are today. I know you put in, and others have put in a lot of work in making this happen. We didn't have, like you mentioned, this is very recent. This was 2020, right in the early pandemic, that the state was working on the certification education, and it became available in such a crucial time, right? As you mentioned, all the different titles, umbrellas, and all the roles. I was thinking about recently with the trusted messenger role that, who is the trusted messenger? And, as you describe in the work, that to me, that's always been that community health worker, that the outreach worker, the patient navigator, the care coordinator, the promotoras de salud, like that they're building relationship of trust with the community because they are from the community. So let's keep, I'm loving this conversation. I hope you're enjoying it too. Let's share a little bit more about, us. Like, all of us are certified and all of us have been doing this type of work. And Millie, Millie Landock, you were sharing some of, the work during COVID. Does anybody wants to share about your own experience as a certified CHW, like the maybe a little bit of why you chose this career, like what brought you to this type of work, and anything you want to share for those that may be thinking about it and they're not sure yet if this is for them.
I think I can share. I have always worked within the healthcare system, and I think my path to a community health worker was defined by my ability to speak two languages within the healthcare system. So not just this one, but others. I found that, initially when you were fluent in two languages, someone would call on you to help a patient that didn't speak English, right? And I'm fluent in Spanish. And so then I would find myself getting pulled into the exam room, getting pulled to the reception. And then in my role, which was working with patients, cancer patients, I found that, their language really played a part in whether they were able to get their medical records together in order to get a visit, to get seen by the radiation oncologist sooner, or, sometimes they really didn't understand the next steps that a doctor was asking them to do. Or sometimes when I was in a room helping interpret, I would see that the patient wasn't really understanding what the provider was asking them to do. And then that's where my advocacy came in and said, you seem to not understand what I see that you're not really clear. And, just being able to help the patient have all the information that they need in order to make good health decisions, right? Decisions for themselves and their family. And so then, my path forward was really thinking, I could be doing more, right? Not just in my role as a coordinator or as a registration or administrative assistant, but I could really do more with patients and help close those gaps, those disparities that patients have, especially if you're not fluent in the language or you're receiving health information in a language that is not your preferred language. So, that was my path forward to being a community health worker. And then, also being able to then have enough knowledge about the role within the healthcare system to be able to strongly advocate for the scope of practice of this role. And, to make sure that we're hiring and also allowing community health workers to continue to do that role.
Thank you, Liza. That's great. Thank you. And I can relate to some of what you're sharing. So I thank you for sharing your story. Anybody else? Any of the Millies?
Yeah, I'll share a little bit. What led me to doing this type of work is I've always, since I was young, I've always found that people get comfortable very quick in sharing their personal, what they're going through with me. And so because when someone shares with you their struggles, I took it upon myself to go searching for whatever. She mentioned to me that she was going through a situation where she didn't have food in the home. So I would go and look for look for those resources. This is me being young, and bringing it back to whoever was asking. And so that's what led me to this, and one thing led to the next one, and the next one led to the next one. And I went to school. I had quit school because I wanted to be a mom, and I stayed home with my children. And I went back to school because I really wanted to be, I thought, a teacher. And when I went back to school and I got my associates in early childhood education. And there I met someone else that was into outreach that led me to the next step. And I was like, wait a minute, this is not what I really want. This looks like it's more, like it's something that I would like to chase more, because that would be something that I enjoy, and I do now anyways. I do it without getting paid for it. I was just doing it. And that's what led me to the next step. That's what, brought me to another job that I super, super enjoyed. I stayed there for over 10 years because I enjoyed it so much. And that was being that middleman for that, or that advocate for that family. And that's what led me to Project Access afterwards. So yeah, it's a more on the personal level and more but I can totally relate to everything Liza said as well.
Thank you, Millie. I hear resources, being a helper, a teacher. There is a reward when you're doing this type of work, that if you're by nature a helper, that you find the joy in helping somebody else. And hopefully someone that is listening in today, that they're thinking about their own passion and what they want to give back to the community. Definitely there is a career, let's say, in public health, in giving back to the community. Millie Segino, do you want to share some of your path?
Wow. So I always say that I was born being a community health worker. And my mom was doing this work without knowing that that's what she was doing. And so I learned by going with her everywhere and attending different trainings, and just by seeing her dedication and motivation to work with communities, and how the community was following her, looking for her for advice and information. So, and it was not even in this country. My hometown in Puerto Rico, in the little island, doing this type of work just for fun, just because it was a passion that she had. And I kept seeing that and grew by having the need to help others without really understanding, so why I am the way I am, why I need to be helping everyone. So there's probably something wrong with me. I should not be doing this. But then later on, I understood that it was not even to be a social worker. It was to be at a level of the community. It was at a level of people like me, sometimes with the same issues or different issues, but what we had in common, it was like the need to keep going and to be empowered and to be self-sufficient and learn to provide to our families. This is something that we all have in common with the communities. So it just took me some time to better understand exactly what is it that I want to do with my life. Having kids or all of that, no, what I wanted to do with my life, until I found a nonprofit organization that gave me the opportunity to start working with the community in Bridgeport with the vaccine program. And that's how I started, like officially as a professional. I started doing this, connecting. I already knew the community, knew so much, was involved with different programs and trainings, until I kind of switched gears into, it is not just the community, but it's also a workforce that is in need. So the same way I am representing a community, I am also representing a workforce. And the same way the community was reaching out to me, I saw the workforce reaching out to me as a leader. And I said, okay, so this is what I'm going to continue doing until it took over my whole scope of practice. I will say that I switched more from providing to the community and then started providing to the workforce. And I have been doing trainings for community health workers since 2009. That's how my passion kept growing because it was not limiting myself to just do one piece and it's one community. I'm talking about all the communities in Connecticut, and I have been growing within what I represent, this workforce, that we are at a national level. We participate and with different organizations. So I mentioned at the beginning that I am president of the Community Health Workers Association of Connecticut, and that is how I do wear my other hat. I need to clarify that this is volunteer work. What I'm doing as president of the association since 2009, when a group of community health workers that I trained for the first time in my life, they had the passion and the interest and the motivation, and they really put me to be in as a leader to guide them. I didn't know what I was doing, but I had people and leaders that had passions as well, and they were my mentors, and they guided me, and they are still behind me supporting the work that we are all doing. So as an example, Millie Landock and Liza Esteves, they are both board members. Giselle, you have been participating with us in many different work groups, having discussions, brainstorming, debriefing about so many things that we see them happening now. Now is the real thing. We talk about things, we did the action, and now we have the outcomes. And in Connecticut, the great outcomes that we have is definition, scope of practice, certification. Now we are in the process of sustainability, looking for sustainable funding, so our community health workers don't feel that after I finish with this program or project, I need to think where I am going to find a job. We don't want that to continue happening in Connecticut. We want our employers and leaders to understand how important community health workers are for the community. We are part of the team. We need to continue being part of the team to support our communities, be empowered and live a better quality of life. So the pathway in my life brought me here, and this is what I'm doing. And I will continue until I have Millie, Liza, Giselle taking over, and other great leaders that we have. At some point, I just want to be on the side looking at you guys and just being so proud of you, because all the work that you have been doing and the support that you have been giving the association in Connecticut. So, thank you so much.
Thank you, Millie. But you're going to stay with us for the next 40 years or so, Millie. We need you.
I'm crossing my fingers to that.
You're doing amazing work. And as I listen and I hear you share your story, it reminds me of back in the day, over 11 years ago, that we were sitting in a very, very small table with other CHWs across Connecticut, and seeing what's happening now and all the work that you put in, as you mentioned, a lot of volunteer work, and really taking the time to share with others, train others, meet with us, each of us, and share the work and the how and the connections, because a lot of this work, it's all about the connections that we make, the connections that we build. Liza Esteves, I'm thinking of the days that you reach out to me or I reach out to you with, hey, do you have diapers? I need milk. Do you have testing kits for COVID? And it's all about those connections. So let's talk about some of those there's some things that I know we have access to. There's some resources that are really strong in our communities, but this is hard work. And like Millie said, you're mentioning the advocacy that we do. A lot of what we have to do is really voicing what we see the gaps are. And I know during COVID, like Millie Landok, you mentioned housing. I know there's some resources that are really hard to address right now, and it can be very challenging for CHWs to really help a family in need. Can we talk about some of those? The challenging, like the hard resources, the hard stories that you're trying to address, and what you're seeing in the communities.
Yeah, the hard situations are, for the most part, that housing need. It's extremely hard to address homelessness, resources, to figure where are those resources. Every program has requirements. The requirements that are so hard for people to meet those requirements, and it makes it into that big long cycle of continue that homelessness situation that seems endless, and all the struggles that even. I was in a meeting yesterday, and there were three people that shared their personal struggles, during their life with regards to housing. Some requirements. Someone shared one of the requirements was that she could not, in order to get this program, this housing program, she would have to be off of. She would basically give up her marijuana card. And this is that she needed this treatment. She wasn't using it just to use it or as a recreational, substance. She was using it because this is her medication that she needs to treat, an issue that she's having, and she couldn't get into that program because of that. So all these barriers that people get in their way of their housing to resolve their housing need. It's tremendous. So that is a big piece. Another big piece for another person shared her struggles with domestic violence and how she also had a million barriers to the reasons why she could not be housed, because again, all those requirements that are placed that programs get, right? So that's a big one right now. To how do we guide a person to a program, and then that program gives this person barrier after barrier after barrier. So the need is prolonged for way too long. And so in my head is like all these rules are placed by the program, and who puts the program together, right? Who funds these programs? Why do all these requirements got to be put into place, and the people continue to be homeless? That's a big one for me to sell.
Emily, that sounds like, they're systematic, like the processes and things are put in place with, it sounds like, with the goal to help, but something it can create barriers as the processes are not easy for everyone to access. And it does remind me, Millie, of, what we saw, and Liza, feel free to share to your experience, and Millie Segina, what we saw during COVID, right? As COVID was so new to all of us, and we, things were being put in place quickly as things were shutting down. Like the homeless shelters were shutting down, and like really putting things in place, like testing sites, the locations, the transportation for those that don't have their own cars, and we're, so let's talk about, not to bring us in a downer, but like really, this is hard work, and it's so needed. And And like Millie, you're describing, it's, voicing the gaps and the challenges with the processes, the requirements. And, we all help individuals that don't read and write in their own language, that they might have a disability, that, substance abuse on top of mental health and homelessness. And, these are very, very challenging, situations and individuals that we're really trying to help. And we see those systems and processes and the barriers with the resources. Lisa, do you mind sharing a little bit of, I've known you've done so much work during COVID with the hospital across, the state, with access to COVID testing, screening for social determinants. Do you mind sharing what the hospital, the health system has been working on, and some of the barriers and things that you're trying to address?
Yeah, so during COVID, community health workers were co-located at mobile testing sites. So we were in Bridgeport, New London, and in New Haven, screening for social determinants of health. We were also providing health education regarding prevention and mitigation, why testing was important, and also, helping folks access community-based organizations. But also, I think what was really important, and what really exacerbated during COVID, was that what we realized is that folks that didn't have primary care struggled, right? You didn't have a primary care provider. And I think this is why the CHW role is so important in educating regarding why your PCP is important, because those folks needed an order to get tested, right? So they needed a PCP to order a testing in the beginning. And then they, when they wanted to get cleared to go back to work, they needed a PCP to sign off and say that they were okay to go back to work. And so then what you did see was folks that had established relationships with primary care were able to get a test, isolate during their, COVID bout, and then their PCP was able to sign off and they went back to work. And we saw people out of work 20 and 30 days because they didn't have a primary care doctor to sign off for them to go back to work, which meant they were not getting paid. A lot of them were hourly workers. The urgent care wouldn't sign off for them to go back to work. So I think what we learned through there is that our role is not only to provide resources related to housing and food and transportation, and those are really fundamental things to have, right? If you don't have your basic core needs, you can't focus on your health. But I think it's also important for us to, as community health workers, to really, help our patients understand, our community members understand how much, access to being healthy affects, your life, right? Things that you may not always understand, that, you don't always understand how a PCP is going to affect your life or being able to access services. But I think it's important for us to continue to educate folks on how important, a primary care doctor is. And then also we, help with vaccine access. I think in the beginning, access to vaccines was only online. And, there were plenty of people that didn't speak English, that didn't have a computer, didn't have Wi-Fi. And so then we, spent our time canvassing in communities and providing access to scheduling for vaccines. So that was our commitment. That was the health system's commitment to the community during COVID, and the commitment after, because the health system has, we are not grant funded. We are all hospital employees, and that is the hospital's commitment to community health workers.
And Liza, I know during COVID, I talked and I advocated about the need for an army of CHW. So can you share, because I know, we've known each other for some time now, many moons ago we met. And has that team, that army grown? Like, do you see a need for more? Is it enough? Are there enough? And this can be a question for all of us. Are there enough CHWs right now in Connecticut, or is there a need for more?
Yeah, so during, we initially started, Yale New Haven Health System started with 2 navigators in our program, and COVID came along and they increased our group from 2 to 17. So there was a real growth, and they recognized the need for, for outreach into the community, and for us to be in the community, really educating our community and community partners. And it was difficult to, recruit for those 17. What I found was that CHWs, they were in demand. There was a lot of opportunity for CHWs. And so then, we continue to feel that there's a shortage of community health workers. We would love to see, more folks that have that passion and that desire, or want to just do more, or are working in a role where they are doing this somewhat, but feel the need that they want to do more. We would love to see those folks, complete the process to becoming community health workers, so that we could have a pool of applicants that would be able to apply for the positions. Right now, we have a couple of them open, and it would be great to have multiple candidates applying for those positions.
Thank you, Liza. And before we end today, I would love to, offer to those that are listening opportunities. So I know, like Liza, you're mentioning the need for more, and Millie Seginat, I know you work with a lot of training in the community. Would either of you would like to share some of those opportunities, how to apply, how to find those job opportunities, training opportunities, and even to reach out to you if someone is listening and they would like to learn more on how to get started. Again, like we shared today, we're talking about community health workers, but there's many other roles, other titles. So we're happy to have a conversation after today if someone's interested. So who would like to go first? Millie Seginat or Liza, would you like to share some of those opportunities with the public?
I can share briefly. There are at this moment a lot of opportunities all around the state. So if those individuals that are interested, they can connect with the Connecticut Department of Public Health. I know that the American Job Center, they are looking for individuals that might be unemployed or in the process of changing careers, so they can have a conversation there. Another opportunity is for those individuals that are SNAP recipients getting food stamps. They also qualify to be trained within one of these certifying training vendors, approved training vendors like Gateway Community College specifically. So they can go through all of these, get the information, go through the training. I want to mention that right now there are one entity in Connecticut is looking to hire 24 community health workers. So this is a great opportunity, and I am blasting emails because the association is one of the entities promoting all of these work and opportunities. So, I mean, the opportunities are there. This is one workforce that will continue growing. And we want people to know that if they are interested, we really need people from our communities to be part of the workforce. Okay.
Thank you so much, Millie Seginat. And Liza, would you like to share some job opportunities within the health system?
We have positions open, ynhh.org, the careers page. And if you keyword, if you type in community health worker, you should be able to see the job description, and the link is there for application.
Thank you, Liza.
Giselle, I just want to give the phone number for the association in case someone is interested in getting more, can connect with us. The number is 203-850-3512. So,
Millie, how about we say it one more time in case someone was getting a pen to write it down? Would you mind repeating it, please?
Absolutely. 203-850-3512.
Wonderful. Thank you, Millie Segina. Millie Landuk, any final comments, thoughts, things that you want to highlight?
The only thing that I want to say for those that are listening, that if you feel that you're a helper, that you have like an inquisitive brain, like searching for things, or being that person that brings joy to others, being that person that you have an easy way of communicating with those within your community. Don't hesitate. Come along. Get on the path, because it is a very fun and fulfilling path. So yeah, thank you.
Thank you, Millie Landuk. And I'm going to offer for anybody that is listening that knows someone that is uninsured and needs access with specialty care, and it's from the greater New Haven area, you can also call Project Access New Haven at 203-773-0838. Again, it's Project Access New Haven at 203-773-0838. I would like to say first, thank you to all of you. I know you're extremely busy. I know how busy you are. And also for those that are listening, thank you for joining today's special show. A big thank you again to Tom Ficklin for allowing us to have this great conversation. And please do reach out to any of us if you have questions. And I hope everyone has a wonderful Memorial Day weekend, and please stay safe.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'm gonna roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going. Better go in the right direction. In the moment you stressing, but you gonna be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. I'm never gonna give up. Fall down, I just gotta get up, yeah. Cause this is my road. Let's camera action, I'm ready to go. I'm never gonna give up. Fall down, I just gotta get up, yeah.